Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera, selamat petang. Apa khabar warga Facebook? Alhamdulillah hari ini hari Jumaat seperti biasa. Setiap petang Jumaat jam 4 kita akan bersama-sama dengan KPJ Sabah Specialist Hospital untuk sesi FB Live. Pada petang Jumaat ni selalunya kita akan berdiskusi, berbincang, berborak-borak, berkopi-kopi bersama dengan pakar daripada Doktor Pakar daripada KPJ Sabah Specialist Hospital. Terima kasih kepada KPJ Sabah Specialist Hospital kerana masih lagi memberikan saya peluang untuk kita bersama-sama belajar tentang masalah perubatan kesihatan yang selalu kita jumpalah setiap hari. So hari ini kita akan bersama-sama dengan Datuk Dr. Heng Aik Cheng, kita punya pakar bedah ortopedik daripada KPJ Sabah Specialist Hospital, untuk kita bincangkan pasal masalah lutut. Lutut. Masalah lutut ni, saya sendiri pun ada masalah lutut, tapi tak apa, nanti kita discuss. Okay, sebelum saya teruskan, terima kasih untuk yang dah bersama-sama. Tolong kasih komen dulu, boleh dengar dengan jelas ke tidak, boleh nampak dengan jelas ke tidak muka saya ni. Tolong tag kawan-kawan, especially yang medical daripada KKM yang nak collect you punya CPD point, tolong tag kawan-kawan yang belum lagi cukup CPD point untuk apply APC. So, yang belum kenal, nama saya Dr. Haizat bin Daud dari Klinik Sabah. Kepakaran saya ialah membantu kaum lelaki dewasa dan kanak-kanak untuk bersunat dengan selesa, cepat dan selamat bagi mendapatkan burung yang sihat, bersih dan menjadi idaman wanita. Saya juga adalah doktor perubatan keluarga yang membantu pasangan yang masih lagi belum dapat anak untuk membuat pemeriksaan awal kesuburan sebelum saya rujuk untuk berjumpa dengan doktor pakar kesuburan di hospital swasta ataupun hospital kerajaan. So, apa lagi? Kalau semua sudah ready ke ni? Saya nampak ni ramai sudah ni. Kebanyakannya daripada KKM, Zizi Manja, Diana, Nathaniela, Ishad, Heng Aik Cheng, Josiana. Ramainya. Jangan lupa tolong like, tolong love, tolong tag, tolong share. Okey, tanpa melengahkan masa, kita jemput Datuk Dr. Heng untuk bersama-sama dengan kita.
Hello Raizat, how are you?
Hello Datuk, fine, very good. How are you Datuk?
Good, very good. Yes. You got nothing to do on a Friday afternoon, huh?
Have ada allocation time allocated for this session lah.
Okay.
So okay Datuk, before we proceed, mungkin you nak perkenalkan diri dengan kita punya viewers ni, mungkin ada yang belum kenal you.
Okay, my name is Dr. Heng. I am an orthopedic surgeon, Pakar Orthopedik. Dulu dari Queen dan lepas itu pergi Sabah Medical Center, dan lepas itu Sabah Medical Center kena bought over by KPJ. So I all the time. Kan? So
okay.
Yeah.
Okay Datuk, maybe we can proceed. Kita punya tajuk topik today, hari ni kita nak discuss pasal osteoarthritis ni. So macam mana kita nak approach? Mungkin kita boleh start daripada mungkin the symptoms first ke, ataupun you nak cerita pasal anatomy of the knee first ke? It's up to you, Doctor.
Can. I think the important thing about osteoarthritis of the knee is that in many cases it is misdiagnosed.
Misdiagnosed, okay.
Right? A lot of people think, oh, lutut sakit, obviously I have osteoarthritis. Actually, I would say if you are below 60, 90% of them don't have osteoarthritis.
Okay.
All right. Most of it is because you have, soft tissue injury of your knee. For example, a hamstring problem. Majority of people actually have this thing called a hamstring problem because the knee is very tight. They don't straighten it. All right, enough. So it becomes very painful. The people who are active, right, sportsmen and all that, they have problems. A lot of it is not osteoarthritis of the knee. Let me just show you. Okay, I'll just show you this picture here, right? So you can see, if you look at the picture here, osteoarthritis of the knee affects this one. But if you have a look at the knee inside, you will see all these other things right inside here, which is the meniscus, kan?
Meniscus, yep.
Kan? Nah, So you can see this is the meniscus, and then inside there further you can have this other thing, which is the ACL. All right?
Cruciate ligament.
Yes, anterior cruciate ligament. Now, a lot of young people who complain of knee pain have two things. Okay, one is they have actually injured the ACL or the meniscus, which is in here, right? And the other thing, of course, is that their muscles are too tight, so it's a hamstring problem. All right, that is if you're young. Okay, now if you are over 60, and as time goes on, then of course things like osteoarthritis comes in. Okay. So you want to ask yourself, what are the causes of osteoarthritis? Now, number one, the big cause of osteoarthritis is, this is your knee joint, all right? And it is made up, see, this is your knee joint. There is, from your femur, there is one, which is this smooth part here. There's another smooth part here, all right?
Okay.
From the bone. And then you have from your lower leg, which is from the tibia, which is again, you will have the tibia, which is, let me show you, all right? Ooh, not very good, huh? Okay, there you go.
Like that.
So you will have these ones here, right, and these ones here, okay? So osteoarthritis, if you have a look at this joint, and if you look at any joint at all, you will find that there's a solid bone, okay? And then if you look inside the joint, there's a very shining white thing. Next time you eat soup tulang, you look at your soup tulang.
The cartilage, cartilage, is it?
Right? That's called the articular cartilage, right? Which
cartilage,
is very, very thin white thing. All right? Now that is the thing which is responsible for making your knee move, right, smooth and easily. So what happens when you have osteoarthritis is that this thing has, number one, worn out. Number two, it has been damaged. Now damage, because when you were young, you played sports or you did something and bang, 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 right? So the articular cartilage has been knocked out. Right? So after a while, you don't have any more articular cartilage, then it almost becomes like bone rubbing against bone.
Bone, yep.
Right? That is then called osteoarthritis. Okay?
Okay.
That comes from young people with sports injury. Right? People who have had accidents before, etc., right? You have damaged your articular cartilage when you are young. So as a result, when you grow, it gets thin, gets damaged. So by the time you get to 60, you've run out of articular cartilage, right?
Okay.
So that's when the knee starts rubbing against and it's painful. Okay? Then people who are overweight.
Okay.
Right?
Overweight.
See, your it's like this, your knee can support your normal weight very well.
Okay.
Say your knee is made for you, your size, let's say, is 80 kilograms. Okay? So your knee supporting 80 kilograms up to 85 kilograms, it's very good. Right? You can, if you don't damage it or anything, you can live until 70 or 80 years old without having damage, right? Without having any osteoarthritis. But if you're overweight, right, you put a lot of stress onto your knee, right? It's just like your car. Your car tire, right, for your car, let's say, can support, right, 400 kilograms. Now, if you put, right, 600 kilograms in your car tire gets worn out very fast. Right? It's the same thing. So the same thing with your knee, right? If your knee, right, is made to support you, your weight, you put extra in it, you are going to, cause the cartilage to wear out faster.
Okay.
This is very much a problem that, we didn't see before, but we will be seeing now, and I will see a lot more. Because Malaysians are the second most obese people in all of ASEAN. Right?
Second most, okay.
Fattest people in all of ASEAN. So therefore, you would expect, right, this to happen. So this is what happens, all right? So just go back again. Reason you have osteoarthritis is number one, you have damaged it before in an accident, or you may have damaged it in sports, all right? Second thing is you're overweight, okay? You're good. And the third, which is, very, very small percentage, is just bad luck. Like everything else, right? You can have bad luck and you can get it. So this is what happens, all right? Osteoarthritis. I mean, the last bit is like those are minority. Some people got gout in the knee. Okay, very few people have that. Okay, okay, you can have gout in your knee. Okay, that causes that. Some people are lucky, got rheumatoid arthritis. Rheumatoid arthritis is different from osteoarthritis. Okay, rheumatoid arthritis is your own body producing antibodies which attack your own articular cartilage. Okay, so in that sense, the uncommon ones are things like gout, like affects there. The second thing is of course rheumatoid arthritis, but those are not common, right? Only the common ones we see are people who are overweight normally. I mean, that's the biggest problem, really, overweight. And then of course people who have damaged it before in accidents or damaged it before in sports. Okay? So these are the general reasons for osteoarthritis. Right? Excess wear and tear, that sort of thing. People who work, laborers, for example, carrying very heavy things and all that. Okay, so those are the causes of it. What do you complain of? Pain in the knee. Of course, pain in the knee. Pain.
Yes, correct.
But like I said earlier on, there are many causes of pain in the knee. So the most common one, the easiest way to diagnose osteoarthritis is you do an X-ray.
X-ray.
And the X-ray will immediately show you, right? That there are all these things that's happening into your knee. All right. It will show quite easily, quite clearly. Okay. X-rays does not show you, things wrong with your meniscus or your ACL, or things like that. But when you have worn out your cartilage, all right, all these things worn out, the X-ray will show it quite easily. All right. So you will not need an MRI scan to see osteoarthritis. Okay, you need an MRI scan to show meniscus problem, to show that you have this problem with, with your ACL. But if you got osteoarthritis, no need. All right, it's a plain X-ray. You can say, nah, ini kamu punya kaki. All right, okay. That's bad. Then what you can do is, if you get it at an early stage, then you can tell them, please try and lose some weight. Right? Okay, if you lose so much weight, there are chances that you may be able, right, to have less pain. All right. Try and exercise a bit, move it around, right? Get it moving a bit. But that helps. Right? See? Then if it doesn't, then you'll probably need an operation. Okay? But let's not go into the operation yet, right? Because I think it's like this. If you come to me at the age of 45, 50, I will say, try and lose some weight, right? Try and do a bit of exercise, to loosen it up and things like that. And I will look at the X-rays and see how bad it is. Okay. Now, if you come to me at a different age, at 60, for example, and you're overweight and all that, I
Mhm.
would say, okay, try, losing weight in 6 months' time. If you really can't, then okay, we can do an operation, right?
Mhm.
The operation is it's very good nowadays. It's
Mhm.
no problem. In fact, certainly gets you back up walking very well,
Mhm.
no pain. And generally, nowadays, it can last you 15, 20 years easily. All right.
Mhm.
Right. So, which means to say,
Mhm.
if you came at 60, for example, right, it can easily last you until about 80 years old.
Mhm.
Right. So that's the
Yeah,
nice
yeah,
thing
that's it.
about it, right? If you
Mhm.
don't, after the operation, please lose weight lah, macam.
Mhm.
Okay.
Mhm.
Right. But nowadays, it's much better, right? When total knee replacement first came up, maybe 10 years, maybe 15 years, you see. So if you came to me at 55, I would, or 45, I would try and not do it yet. Because if you
Mhm.
do it, then you may need another operation, right? That's, what I
Yeah,
mean.
correct.
But now it's much better, but still, we will try to advise you,
Mhm.
uh, you know, let's, tahan sikit,
Mhm.
lose some weight, get fit.
Mhm.
Because after the operation, you will also need to lose weight,
Mhm.
right?
Correct. Mhm.
Because if you don't after the operation, what will
Mhm.
happen is you put more, you again, balik stress lagi, balik all this again,
Mhm.
these things are worn out.
Mhm.
So initially, what we will do is we will tell you, number one, lose weight. Okay, I can
Mhm.
give you some tablets to take, to take some of the pain away, etc., etc.
Mhm.
And then after that, as things get worse, then let's say, okay, I think you need
Mhm.
an operation. All right.
Datuk, I got some problem. Not to say problem lah, but some of my patients yang memang ada overweight. They overweight and then they have knee problems lah, knee problems. So we suspect that the weight has given the stress to the knee. So when we ask them to exercise, dia cakap, doktor macam mana mau exercise? Saya punya lutut sakit, saya tidak boleh jalan jauh, saya tidak
Sure.
boleh jogging. So
Yes,
what would you advise?
You're right, actually. You see, walking and jogging or whatever it is, you're putting, it's stress, right?
Stress to the joints, yes, correct.
So what I tell them to do is get a bicycle.
Okay.
Right? When you're cycling, there's no stress. Okay?
To
You
the
don't want
knee.
to walk, you don't want to go out to the road to cycle, okay, that's fine. You get a bicycle, an exercise bicycle, put it in your house. But the most important thing is you must put it in front of a TV. Otherwise,
Okay.
it's so boring,
Uh-huh.
right? After 5 minutes, you give up.
Okay.
So
Understood.
the most important thing I always tell them is, yes, I know it's very difficult for you to exercise, very difficult for you to lose weight. So the only thing for you is a bicycle. Low stress, no stress almost, okay? But very important to put it in front of a TV. Otherwise, you will be bored. Okay? That's one. The second thing is if you can swim, that's the best exercise because
Yep.
again, completely no stress.
To the
You're
knee, yeah.
exercising your whole body. Okay? That is very important, even better than cycling because you're exercising your arms, your back, and everything else, right? So I will tell them, yes, I understand you cannot walk. These are the two things that you must do. You must discipline. You must do it. And it's also important because eventually you need, like I said, if you need the operation, after that, you also have to lose weight.
Yes.
You also have to exercise to get back the
Mm.
strength. Otherwise, you will find walking very, very difficult. Now, the only danger, which is very, very small, okay, with a knee replacement, is that you may get an infection. But that's a very, very small percentage. So, that's the only danger. But this is, like I said, bad luck. Sometimes, if you do a 100 operations, maybe one kena. It's not, it's just bad. But that's the only danger about nowadays. Like I said, it's a common operation. Surgeons are very competent at it. So that's what, your question.
Is there any specific medical treatment like macam itu untuk I'm not sure whether some patient lah yang datang dia cakap ada supplement that can actually rejuvenate you punya cartilage and everything. Is that a standard treatment that you do or how?
No. That's all. Okay, sorry, there's nothing at all. Okay. A lot of take supplements. I keep telling them it's a waste of time. Right? Don't take any supplements. You can ask your doctor. Your doctor doesn't take any supplements. Right? You can ask all the specialists in KPJ. Not a single one takes supplement. Right? What does that mean? It doesn't work. All right? That's all. So, I mean, some people take glucosamine and things like that.
Yes, glucosamine.
It may work, okay? I mean, that's small. But, glucosamine may work for small joints. Right? Small joint. But when you have a joint as big as your knee, it doesn't work. Okay? And then there are some people who pay a lot of money and get a stem cell injection. Right? Again,
yes, correct.
That's a lot of money that you pay, and the chances of it working is, personally, in my experience, and of course, in a lot of people's experience, actually. Honestly, it doesn't work.
Hyaluronic acid?
Okay, it's not bad. Right? It doesn't cure it.
Yep, understood.
Okay? It prolongs, the period that you have before your operation. It doesn't cure it. That's all. And if you think you can have a Hyalase injection into your knee and get rid of the pain, forget it. It doesn't. All right? No, this doesn't get rid of the pain completely. All right? So don't. All right? It's like a multivitamin. Helps. Helps you. But it's not cheap. It's $2,000.
Correct.
Right? Yep. So, I mean, if you have a lot of money, okay, fine. Right? That's fine. $2,000 maybe help a little bit. But you got to do it every year as well. See? So, yes, it may contribute a little bit, but it's not a big deal. Now, the dangerous one is you go to see some people and they give you an injection and instantly no more pain.
Steroid maybe.
Steroid injection. Right? This is a steroid mixed with lignocaine. Wow, instantly no pain. Very good. But it doesn't last. Right? The pain will come back in 1 month's time, 2 months' time. And because of the steroid, it damages your bone in your knee. It becomes hancur semua. Right? So the ones that work beautifully, wow, instantly satu jab, no more pain. That is the most dangerous one.
Dangerous one.
That okay, you shouldn't have. All right? Especially into the knee joint. All right? Into the knee joint. Okay? So there you are. All right? Good.
What about braces? Braces of the knee. Is it maybe it helps to a certain extent or
helps to head? I mean, if you really want to help, you go and do some exercise and cycle or swim. That's all.
That's all.
Right. Braces doesn't really, to be honest. Okay, it helps with people who are, those people who have unsteady knees. It may come because when they were young, they tore their ligaments or something. That may help you, hold it in place. Okay, braces. But other than that, it's fine. All right.
So, okay, we are now at 25 minutes already. So, maybe we take one question lah. Sam Akhtar dia tanya, Datuk, what about a plasma
itu
injection?
sama juga. Plasma injection, Hyalase semua. Kau bagi duit saja.
Membazir duit saja.
That's all. All right? Doesn't really work. Okay, Sam. Sorry.
So, okay, I think we have another few minutes. So, before we end our session, maybe you want to share take home message or to our viewers here today.
Number one, don't be overweight. That's the
Jangan berat badan.
message. That's the biggest message, because nowadays we are seeing many people who are overweight. Okay, sorry, okay, but this is the truth, and don't be overweight. Number two, exercise while you can, while you're young. Exercise, okay. If you love playing football and all this, if you damage your knee, okay, but that's a price that you have to pay eventually. Right? Your love for your sports is different, from okay. That one I cannot do anything about it. Okay, you want to play football, you want to play basketball, it's a sport, okay, but be prepared that you will have this. The rest of it, the biggest message is please lose weight and don't be overweight and don't be fat. That's all.
That's all.
Okay? And do exercises, do stretching. Okay, because you see what happens is a lot of people have hamstring problems. See, let me show you. I'll show you this again. This is a total knee replacement. So when you do a total knee replacement, although this is replaced, okay? Right, you see that? With metal. At the bottom, it is replaced with, again, another metal, right? Another metal here, and then a plastic on top of it. So therefore, this becomes your total knee. What you do. That is the operation. You brace up there and down there. Okay? That's the total knee replacement. So, yes. Now, the other thing,
hamstring.
a lot of people, right? Your hamstrings. If you have a look at this, okay? The hamstrings are the muscles and the tendons at the back. Right? And a lot of people then, after running exercise, they don't do the stretching to stretch it up, so the knee ends up like this. You can see a lot of people walking around where the knee is not straight, or if they do exercises to straighten the knee, it becomes very painful at the back. So the important thing is you must stretch your hamstrings at the back. Okay. Now, what happens if you don't stretch your hamstring? Your knee is forever in this position. See that? So when you're walking, the stress is all around this area. So that will cause your articular cartilage to wear out a lot faster than when you're walking normally. Okay? So there. Number one, make sure that you've lost all your weight. All right? No excess. Number two, do a lot of stretching. That's all. The rest, enjoy your football. I can't help it.
Okay, Datuk. Thank you very much for the session today. I learned so much today. So thank you very much. Bye. Thank you. Bye. So, okay. Terima kasih untuk yang mendengar sesi pada petang ni dengan Datuk Dr. Heng Aik Cheng. Hopefully anda belajar sesuatu. Saya pun belajar sesuatu. Refresh saya punya knowledge balik tentang osteoarthritis of the knee ni. So hopefully hopefully anda share, tolong like, tolong love, tolong tag kawan-kawan, tolong like dan follow Klinik Sabah dan KPJ Sabah Specialist Hospital punya FB page. InsyaAllah kita akan bersama-sama lagi mungkin dalam minggu depan, hari Jumaat pada waktu yang sama dengan spesialis yang lain. Terima kasih KPJ Sabah Specialist Hospital. Kita jumpa lagi. Assalamualaikum dan selamat petang.